Hello everyone, I'm Dr. Wiquar and I'm a consultant pain physician at Alleviate Pain and Spine Center, Bangalore. Here at Alleviate, we believe in multidisciplinary approach to pain because pain is not only a physical aspect, it's got an emotional aspect associated with it. We offer pain management, spine care and regenerative therapies at our center. Shoulder pain is one of the most commonly encountered pain in any OPD. We'll be discussing about the basic anatomy, the multiple pain generators in and around the shoulder joint, as well the treatment for any particular pain associated with the shoulder. The shoulder joint is actually a connection between the upper limb and the axial skeleton. It consists of an articulation between the glenoid fossa and the humeral head. If you see, the glenoid fossa is quite shallow and the humeral head comes and articulates with it. It's quite mobile, but the stability is compromised. Stability is basically maintained because of the myotendinous rotator cuff which is present, a glenoid labrum which is there, and the arch formed by coracoacromial ligament. It is a type of synovial joint, ball and socket variety. There are multiple pain generators around the shoulder joint. We can divide these pain generators into glenohumeral, extraglenohumeral and referred pain. Referred pain can come from something like a heart attack or an MI. It can also be referred from the abdominal pathologies. In glenohumeral joint, it can be a myotendinous rotator cuff tears or tendinopathies. It can also be an arthritis which causes pain. Bicipital tendinopathy. The biceps where it comes and attaches, even a tendinopathy of that can be referred to the shoulder. And there are multiple spaces which are fluid filled called bursas. Their basic function of a bursa is that it helps in avoiding friction and giving cushion. But these spaces can get inflamed and they can be a major pain generators. Adhesive capsulitis, also commonly called as frozen shoulder. As I explained to you earlier, there is a joint capsule around the joint, and this joint capsule, there are adhesions which are formed, and because of that the patient will have excruciating pain. It is divided into 3 stages. The first stage, the patient has excruciating pain, and because of that he is unable to move the limb, and the next stage the limb gets frozen. The third stage is a recovery stage. This 3 stages take close to 1 to 2 years for recovery. When we come down to the treatment part of frozen shoulder, we need to do physical therapy, but because of the pain, the physical therapy is not that easy. So for that reason, what we do is we give a nerve block. There is a nerve which is called a suprascapular nerve which passes through this area, and we give an ultrasound guided nerve block, after which the patient will have close to 70 to 80% pain relief. And then we offer them physical therapy, mobilize their limb, and the pain comes down considerably. Diagnosis is very important for any condition. Once a patient walks into our clinic, we take a detailed history and followed by physical examination. Physical examination consists of inspection, palpation, range of movements and special tests, followed by ultrasound examination, which forms a very integral part of our examination. The reason for that is, as compared to any other modalities available, for example MRI and all, it is more cost effective, there is no radiation, and you can do a dynamic examination available at our clinic itself. A very important aspect for diagnosis is to rule out the red flags. Red flags, example is something like a fracture or else a dislocation. This is usually an acute pain. Once we have ruled out the red flags and we have got to a diagnosis, we treat the condition. For example, frozen shoulder. In frozen shoulder, we give a suprascapular nerve block with a hydro release and physical therapy. Once a patient walks into our clinic and we have diagnosed a condition, we also give conservative therapy. Watch for a few days. Conservative therapy will consist of anti-inflammatory medicines and painkiller medicines. But painkiller medicines cannot be given for more than 5 to 6 days. We follow it up with interventional injections at our clinic, but they are not blind, they are ultrasound guided. The other diagnosis which can also be there, degenerative changes like arthritis, which can involve the glenohumeral joint and the AC joint. For both, we can give again ultrasound guided anti-inflammatory medicines within the joint. The third type will be rotator cuff tear or tendinopathy. If there is a rotator cuff tear that is partial, we can follow it with an ultrasound examination, and if we have any doubt, we also can get an MRI done. Once that is confirmed, a partial tear is confirmed, it can also be done with a PRP treatment. If a patient has a subdeltoid or a subacromial bursitis, in that case, we can give injection local with dextrose, ultrasound guided. If a patient also has pain from the neck going to the shoulder and diagnosed as a cervical problem, in that case, we can give cervical epidural injection. If you have any further queries on acute or chronic pain, you can write to us, call us, or consult us.